2, 1. Hi, good evening. This is Dr. John Bennett from Miami, Florida. We're here tonight. We're lucky to have a couple of ER physicians. I didn't really ask you guys. You guys ER physicians or you residents in ER or? At any rate, we're here with two docs. One's Dr. Roger Chai and Dr. Peter Chai and Dr. Roger Wu from Brown University up in New England, up in Rhode Island, from Rhode Island Hospital. We've contacted them because they've worked at the Rhode Island Hospital emergency room using Google Glass, and they're going to discuss a few things about their experiences with Google Glass. So welcome, gentlemen. I don't know who wants to go first, but introduce yourself, and I guess we can do it that. Just introduce yourself first, and then we'll go around and talking about your experiences. Okay, Peter, why don't you go first?
All right, great, John. Thanks so much for the introduction. My name's Chai. I have actually just finished my emergency medicine residency at Brown, where I was working with Roger. I'm currently a toxicology fellow at the University of Massachusetts up in Worcester, Mass. But I still have some ties down in Brown, and we still collaborate on a bunch of projects. And so I'll let Roger introduce himself, and then I think briefly we'll talk a little bit about kind of the need for Google Glass in the emergency department, and we'll talk about the work that we've done in the ER, and talk about kind of what we think Glass and kind of other wearable heads-up devices will do for emergency medicine, which I think is a pretty wide and exciting time for us right now. And then I think we open up for discussion and questions. So I'll let Roger go and introduce himself.
That sounds good, Peter.
Sounds great. Thanks, John, for the introduction as well. My name is Roger Wu. I'm one of the third-year residents at Brown, and I've been working pretty closely with Peter as well as Dr. Paul Porter, one of our attendings here, on using Google Glass for dermatology consults in the emergency department. So, you know, Peter kind of outlined our talk, but I don't know if, are we able to interact with the participants at all for this? Well,
I'll be monitoring the tweet board. If we have anybody that tweets, I'll just kind of interrupt you guys at the opportune moments. So just go ahead, and I'll let you know.
All right. Roger, you want to go ahead and talk a little bit, and then?
Sure. So, you know, as Peter kind of briefly mentioned, we had just a quick outline. We wanted to talk about first the problems, some of the problems that we were facing in the emergency department, specifically regarding dermatology consults. So at our shop, we see approximately 100 rashes through the emergency department every month. A certain percentage of these rashes will require a phone call to our dermatology colleagues, either for help with diagnosis and management or to set up outpatient follow-up. And the issue is, you know, we learn in medical school a whole set of vocabulary to discuss and describe these rashes. You know, what's macular versus papular, what's the difference between a vesicle versus a pustule versus a bullae. But the issue is, you know, one, it's time-consuming to relay a rash over the phone verbally, and also, you know, inferior to just a picture or a video. So that's kind of where Google Glass comes into play, and that's kind of what was the genesis for our idea for the project.
Yeah, and the dermatology telemedicine has been around for a little bit. So basically, dermatology telemedicine, correct?
That's correct.
Yeah, but in a kind of a different manner. So a lot of the dermatology today has focused on photo taking. So just taking a photo and sending it.
I'm sorry, Peter. We can't. Is your microphone okay? Can you hear Roger at all?
No, Peter, I couldn't really hear you back there.
Can you hear me now?
Yeah, it's not. It's kind of muffled.
Is it better now?
That's better. There you go. There you go. Thank you.
So the store for traditional physician taking a photo and emailing it or storing it for the dermatologist to see at a later time to kind of give feedback on the rash, what we've done is kind of turn dermatology consults into a live interactive visual diagnosis. So by wearing glass and using the video aspects of it through Pristine, we've been able to kind of have the dermatologist virtually at the bedside with us in the emergency department when we're looking at a patient who has perplexing rash or another skin condition that we need dermatology input.
Okay, Roger, can you just to get to know you guys, could you briefly describe how you first? I mean, you're young. You guys are young guys. You grew up with computers and stuff. But as far as your computer background, what kind of interests Peter? What's your computer background? Are you really into computers, or it's just kind of a little bit? Could you briefly talk about that, please?
Sure. So, I mean, my background is obviously in medicine. I'm interested in technology and the high-tech world, and I've always been interested in it. I don't really have any formal programming or development background, although I've dabbled in programming for websites and things like that. But really, kind of our impetus for Google Glass is we really Dr. Porter saw an ad for it when he was flying back from a conference on the airplane, and he applied to be an explorer, and we were working a clinical shift the next night, which happened to be Christmas Eve, and we thought this would be a great thing to bring into the ER in our hospital, and we kind of just took it from there, and Roger came along pretty quickly, and that's kind of how we got to where we are now.
Okay, how about you, Roger?
Yeah, actually, I don't have much of an IT background. My background prior to medicine was in business. I spent some time as a healthcare consultant and worked with in venture capital as well with some healthcare startups, and that was kind of my interest with Google Glass initially.
Okay, and so you just Dr. Porter just brought it into the emergency room, or did he have to apply formally for permission to use it, or how'd that happen?
So it was a very long process. Anything coming into the emergency department or a hospital or healthcare setting needs to pass some pretty rigorous IT security barriers. So there's a lot of issues with connectivity to a hospital network. There's also concerns about protection of patient privacy. So there's a whole set of HIPAA as well as high-tech compliant things that we need to become compliant with, and it was actually kind of serendipitously we found Kyle and Pristine through Twitter, and through that we were able. They have engineered a HIPAA compliant solution for Glass, and we basically used their technology in order to kind of satisfy the needs of our healthcare system and allow us to use Glass in the emergency department.
So from that initial return of Dr. Porter from this conference, it was a couple of months before you actually started using it in the ER?
Yeah, so I'd say we got the commercial devices somewhere in early January, and we moved pretty quickly, and I'd say, correct me if I'm wrong, but February and March, Roger, we really started using it in the department at that point.
It was just you two guys, or was it all the ER docs?
Nope, just us three, actually.
Oh, okay. So, and you were just rotating on dermatology or ER? What were you rotating on through when you had?
So I was a fourth year resident. In our fourth year, we are clinically 100% in the emergency department. Roger as well. So we were in the ER, and we were trying to figure out what's the best way to kind of showcase the power of using a wearable device like Glass, and we thought about a bunch of different scenarios, and we decided upon dermatology because the visual, safe than other specialties, and would allow us to kind of get this in.
Okay, would you get the patient permission, signed permission before you transmitted their images, or?
Right.
Is that their general patient consent when they sign the form when they come in the ER?
So we did a IRB approved study. So all these patients had a separate consent form explaining the process. and they were consented for the procedure.
Oh, okay. You know, yeah, I don't know if you know Kyle. Kyle, he, like I mentioned previously, he's been on he's had a hangout. He's had quite a bit of experience. He's worked with anesthesiologists out of California, Irvine. He works with a couple other programs too. So he's been pretty well all over the place. And coincidentally, he has a background in he's worked with HIPAA compliancy with EHRs and stuff. So that helps him, I think, bringing a lot of these programs into the fore. So, so basically, if you had a patient with a skin problem, then you put the glass on and go see the patient.
So the way the study was designed was, patients present to the emergency department with a rash, and
Okay.
of those patients, the ones that required dermatology consult, in addition to receiving the standard telephone consult, we would be called in to perform a glass consult if the patient consented.
And you would, Roger, you would transmit the images to the dermatologist or give a full presentation, and how would that work?
Right, so we had two dermatologists on the other end who were essentially on call during the entire duration of the study. And whenever we would get a consult, we would transmit the video to these two dermatologists.
Okay. And they would advise treatment, and you'd go from there.
Exactly.
Okay, what do you guys have planned? Are you going to expand the use of using glass in ER to other areas, or you kind of done with that rotation and you don't know what's going on, or what's happening there?
So I think that the applications of glass in medicine or be study and dermatology, and I think the next step that we're moving in is looking at telestroke and pre-hospital telestroke, and that's something that Roger probably could kind of expand on. I'm up at UMass in Worcester now, and we are looking at using glass in the emergency department kind of twofold. The first part is as a toxicology fellow, we're looking at using glass as part of a additional kind of enhanced video consult for when physicians call poison control centers across, well, we're going to look pretty much in Massachusetts, but potentially across the country. And the other part is a potential use of glass integrating into kind of a speech-to-text function, so we could potentially use glass to see patients dictate our charts. So there's kind of the two fields that we're going to start moving into, I think.
Okay, yeah. I don't know if you guys follow the use of Google Glass in ER. I know you're probably really busy, but there's an application called Augmedix, based out of Dignity Health in San Francisco.
Yep.
That does exactly what you're talking about. Do you use that program or app for what you're describing as far as text to dictation to text?
No, we haven't. We've really been working with Kyle and with Pristine right now, and we haven't looked at Augmedix. Yeah.
Have you heard of it? Augmedix.
Yeah. Yes, we've heard of them.
Yeah. So you haven't used that yet in the hospital?
No, we haven't had a chance to try out what they have to offer.
Okay.
Yeah, the way we're using glass is actually, in my mind, I see it entirely separate from what Augmedix is doing. Augmedix is more along the lines of an EMR versus what we're doing, which is more like a teleconsult.
Oh, okay. Yeah, that's a good point. Yeah. Well, you guys, when I first saw Augmedix, it was just like a month ago, because I've talked with physicians in many different areas of medicine, and when I saw the use of that in general medicine, I mean, because most doctors obviously have uses of EHRs and EMRs with seeing patients, because no matter what specialty you are, you use that at EHR, EMR. So I think that application has very broad use. I know that there's a significant use for dermatology, but the EHR, wow, that's when I saw it. This may pretty well go mainstream in medicine. What do you guys think?
So I think glass is great for the right application. Kind of the way that I look at it is that there's kind of two things you really do with it. The first is that you stream data into glass, so you're bringing in the EMR. You're looking at patients' lab value, and that. The other part is you're transmitting data out from get through Pristine, so you can get a live video consult. You're using the Augmetics solution, and you're dictating. And I think that both of those things have a lot of potential. There are some kind of drawbacks of using glass,
Okay.
but I think at the end of the day, this is going to be an amazing thing, and it's going to take a lot of physicians starting to adopt it before it goes mainstream, and big health companies decide to start using it.
So, okay, you can expand that. We have no hidden agenda with glass. We certainly want to bring out the shortcomings. So don't be shy. Could you please tell us, both you guys, the shortcomings you see, because we have to examine this objectively. Sure. What do you see as the shortcomings, Roger?
So kind of going off of what Peter was saying, I think, again, you could either stream data in or stream data out. At least in our limited experience, the display is pretty small to show too much information. So really, I think the potential is more about streaming data out. And I think both Augmetics and a lot of other Google Glass applications are focusing on that aspect right now.
So streaming data out, that's where it's strong, but data in is kind of weak a little bit or slow?
Yeah, I think we would just have to be very selective in what type of data that we choose to stream onto the small display screen. Certain lab values potentially or notifications, but at least in our experience, I find it would be very difficult to review, a CAT scan or an X-ray on a small screen like that.
Oh, okay, yeah. The detail will be difficult, correct?
Yeah. Yep.
Okay. What other shortcomings do you guys see? Is slow download for some of the data, or is it pretty quick?
No, I think the download and upload are all really dependent on your hospital network or wherever you're using it. But it kind of touching on that, one of the shortcomings of glass is that it's Wi-Fi antenna is the most antenna, so you need to have a very strong existing wireless system in your hospital to effectively use glass. And then the only other thing I touch on and add to Roger is that the battery life of a glass unit is very, very limited. If you're actively using it to stream either data in or data out, using our video consults, for example, if you're doing a live video consult for an hour, so say you were a surgeon streaming an operation, the unit's going to run out of batteries within an hour, and so that's one of the kind of the biggest issues that we've run into so far.
Okay. One thing I've seen, I don't know if you guys have much experience with this, is there such a thing as a strong Wi-Fi and a weak Wi-Fi? Because when we're going to transmit the conference up in Indianapolis, they have the conference at the University of Indiana, and they have a very strong Wi-Fi signal, so that I find that there's a difference, because sometimes when I talk to physicians like yourself, there'll be a weak Wi-Fi and the transmission won't be good, it'll be broken up, and the audio won't be too good. But other places there'll be a strong Wi-Fi. Do you guys know, did you guys have a strong Wi-Fi at Rhode Island Hospital, or do you know, or it didn't break up at all, or?
So I think we had a middle of the ground Wi-Fi.
Okay.
It wasn't the most robust, but we definitely learned a lot of things. In a hospital setting where, the Wi-Fi may be, what you would call strong because you're using your laptop and you never lose a connection. When you're using a wearable device like glass and you need to use it all the time, so you're live streaming a video, even those tiny interruptions of packets of data will shut down that video stream. So the definition of a strong Wi-Fi signal using Google Glass, I think, is going to need to be a little different than your strong Wi-Fi signal for you to use your tablet on the EMR or using your laptop in the hospital.
That's a good point.
And even within the same institution, so within our 70-bed emergency department, there are different pockets of stronger Wi-Fi signal and weaker Wi-Fi signal. So one of the first things we did actually was to put on glass and walk around the entire emergency department and see if there were any dead spots.
Well, I hope you didn't bring the patient around the emergency room looking for those dead spots.
That was prior to our patient. Yeah.
Well, how long, when you guys started the study, did it take you a while? Let's just assume, okay, for the someone that's watching that hasn't used glass, how long was it before you put the glass on to where you felt comfortable talking with the patient? Did it take a while, or was it pretty intuitive? Was it pretty quickly that you learned how to do it?
So, John, I think one of the great benefits of glass is that it's so intuitive. You put that thing on, and you really just follow the voice commands and what's written on the screen in front of you, and you can figure it out. I mean, when we started with glass, we brought it around the ER, and we would give it to nurses, we gave it to techs, we gave it to some of our EMTs just walking through the hospital, and without any instruction, we just put it on them, and they figured it. You're using it every day, so we've kind of learned to, love and hate some of the subtleties of glass. But it's so intuitive, and from our limited experience with patients, patients love it. They like that. Instead of sitting on a chair next to them with your head down, writing your EMR and writing your chart, you're now wearing a device and you're looking at them and talking to them. So I think the patients will like it.
Good. So that was your experience? Most of the patients liked it?
That's what we're seeing, yeah, kind of anecdotally, that patients are, well, I don't know if I can say they liked it, but they weren't bothered by it. I'll put it that way.
How about you, Roger? Same experience?
Yeah, same experience. We're just wrapping up our study now, and based on the data that we've seen so far, patients overwhelmingly were very satisfied with the experience. And another benefit of using glass as a teleconsult tool is to have the dermatologist virtually present during the visit. So we were able to have essentially a three-way conversation amongst the emergency provider, the dermatologist, and the patient to come up with the plan that's a management plan that's best suited for the patient.
So you would essentially relay questions from the dermatologist to the patient?
Exactly. So we were able to relay patient concerns in real time to the dermatologist, and the dermatologist was able to direct their physical exam, direct their history through the emergency medicine provider using glass.
Would that also apply to follow-up visits? Would he tell a patient, okay, I want to see you at a certain time, whatever?
Right. So that's actually it's an interesting question, and something that we're hoping to look at in the future, because at least intuitively, you would think that if the dermatologist is able to see the patient virtually in the emergency department, that could potentially reduce the number of follow-up visits after the emergency department.
Okay. So, well, you're essentially putting the dermatologist in contact, and they always had a number to call. I guess I knew from my experiences, you usually tell a patient, if you don't get better, then here's a number to call. Here's a dermatologist to call. The gentleman we just spoke on, and I guess that would be the person they would follow up, correct? If they didn't get better with the regimen of treatment.
Well, the dermatologist will kind of be able to guide it, because they virtually saw the patient in the ER, and they would say, if you're not any better, you need to see me in the office, or this is something that your primary care doctor can take care of, because I've seen you and I'm comfortable with that.
Okay. Okay. Okay, that's interesting. Now, Roger, Peter's up in Worcester, and you still at Rhode Island Hospital?
That's correct.
Okay, and you're what year resident? You're a resident now in ER?
Right, I'm a third year resident right now, so I have about a year and a half left.
Oh wow, it's you know when I was in residency, it was a 3-year residency in ER. Now it's 4.
It's a mix. There are 4-year programs and 3-year programs. Brown just happens to be a 4-year program.
Oh, okay, okay. And so it's just dermatology currently that it's being used on at Rhode Island Hospital, and no other areas.
So we're wrapping up our study with the dermatologist right now, and it's just a very simple, straightforward feasibility and acceptability study. It's kind of
Okay.
the first step to everything else. Like Peter mentioned earlier, we are potentially looking into using glass for pre-hospital stroke diagnosis. And we've had some interested parties from other specialties as well that we're kind of working on right now, including like plastic surgery, interventional radiology, and general surgery.
Yeah, there's certainly a lot of areas. I've had a lot of docs on these talks from all areas. It's pretty widespread. You mentioned toxicology, Peter. Now that's also an approved study you're talking about.
So we're currently in the IRB writing process for toxicology, but our hope is to use glass up at UMass, looking at poison patients in the ER.
Yeah, the way I don't know if it's done the same way with you. If you have a questionable toxicology case, you essentially call poison control. If you don't know, if you want to check with someone, and they kind of lead you through. Is it still the same way?
Yeah, that's pretty much the same way. You call poison control, and you speak with a poison specialist who will get a history and a physical exam and pertinent lab values, and they'll call the fellow who's on call, which may be me. And it's interesting because a lot of the times I'm talking to the poison specialist, and both of us are like, this would make so much more sense if we actually just see the patient, and we're trying to kind of solve that piece of it.
Oh, okay. So the poison control fellow or poison control would be able to see the patient.
Or the fellow. I mean, really depending on the mechanism of the consult, the way that things work.
Okay. Okay. Very good. Very good. Let's see. Anything else? Let's see. Well, anything else I didn't cover? I guess. Well, derm is pretty. Well, you guys pretty well covered derm. Do you guys have sets yourself you bring home and use for shopping lists and stuff?
No, we have 3 units that Pristine has given us to use and play with. We're very lucky to work with them. If anyone is looking for this is kind of a plug for Kyle, but if anyone's looking for a HIPAA compliant solution, they've done a great job with us, and we're very happy. The stuff works, which is great. But no, we don't do shopping lists or anything on there.
How about you, Roger? Do you bring it home? I mean, so you have the unit at home you use?
No, like Peter was saying, this is mostly just for business purposes. I haven't been using it in my personal life.
Oh, okay.
The glass that we use also is not the commercial version of glass. And one of the biggest challenges in using glass in a healthcare setting is HIPAA compliance. And like Peter was saying, we're fortunate to work with Pristine. So those glass units we keep in the ER, and maybe sometime in the future I'll get a pair for myself. Oh
yeah, good. I hope you do get a pair. They should give you guys a pair for doing this study. and if Kyle's listening, maybe he'll do that. But yeah, it's. I think we're going to see more use of it. But certainly there are some areas where it will be used extensively, and some areas probably won't be used too much. I certainly can't see it being used too much in a clinic that's not very busy. But I foresee it being used because I worked in the ER. Especially, you guys know when it gets really busy. It seems to me, and I've never even put on a set of Google Glass, but it seems to me a great thing for the ER when it really, how it really gets busy, being able to order stuff, order tests, to walk into a patient room, and without having to call the nurse, you can just say, hey, let's get an ankle X-ray, or let's get a chest X-ray, or let's get a blood gas. Do you foresee it going into that kind of thing? Do you feel like, oh, I think the glass would be good here in the ER? Is there any other specific areas of ER that where you foresee it being used?
I do think that kind of integration into the EMR is going to be a big part of glass. The thing that I think emergency medicine is going to really love about this, it's a little different than your traditional telemedicine solution, where you have, for example, telestroke, where you need to turn on a cart, you got to log into the computer, then you have to turn on the video camera and all this stuff. This is simple. You put on the unit and you're looking at the patient already. You have your specialists in your ear, and you're both looking at the patient from the same perspective. You agree on physical exam findings, and you can make a diagnosis and make a treatment plan faster and more efficient. So I think kind of consults, EMR integration, and I think generally as kind of awareness and a kind of an ER awareness tool. So being able to look at a tracking board, or being able to look and see how many people are waiting, how many people are on their way in, or getting pre-hospital notifications, or transfers from other centers, where now instead of getting a phone call that there's a really sick trauma patient at your community hospital, you're able to see them in that hospital, and you kind of can prepare your subspecialists for what needs to happen when they show up in your shop. So I think that's where the beauty of glass is, and that's where I think it'll probably go in emergency medicine.
Well, you mentioned trauma, or you didn't. I don't know if you did mention trauma, but is Rhode Island Hospital a trauma center?
Yes, Rhode Island Hospital is the only level 1 trauma center in southern New England. We have a huge catchment area.
Oh, so certainly I would think it'd have a use there where you can see the patient, remotely, to triage or whatever.
Yeah, sure. I mean that'd be a very exciting thing to do.
Do you have a helicopter around?
We don't have a helicopter. We use there's a bunch of helicopter services. So Hartford, UMass, and Boston Life Flight fly to us, and we also get the occasional flights from Coast Guard, because there's a Coast Guard station close by.
Okay. Okay. When I worked in the ER, there was an algorithm for thrombolytics. Do you see a use for that? Because you know how you have certain checklists almost you have to go through with a patient for giving thrombolytics. Do you see glass being used in a good way for that type of thing?
I think that part of glass is more pushing the data in, and it's something like thrombolytics, or even starting lysis for an MI. Those checklists have so many things on them that I think it'll be hard to see them all on glass. That's something I would much rather just have a tablet and check things off in front of the patient, or do. I think a lot of the porting data into glass is going to have to be quite selective for it to work.
Okay. And one thing we touched upon on one hangout was how the glass is going to change in design and applications depending upon what area of the hospital is being used at. And glass as it is now with its particular design may change completely for ER as opposed to general office use, as opposed to interventional cardiology. Each one will have a different shape of the glass and different size camera and maybe different size screen. I think every specialty, that's why I really think it's important that docs like you work together with developers and application writers so that you can start from the get-go and design the most appropriate design for glass in the ER as well as applications for glass in the ER. Well, do you guys have anything to say about that? How would you design a set of Google Glass? If you were a designer and you were asked, okay, what features do you want to put in this set of glass for the ER? Is there anything that you would tell that designer?
Well, I think first most, I would improve the resolution of the video camera that it currently has. You know, that's really the function that we've been using it, at least for our project, to you know, relay the video to a consultant remotely. We haven't been using the display as much, so that would be less important in my ideal design for glass.
If you had, for example, if you had a small rash and you wanted to blow up the image or make it bigger, would that be possible? You know what I mean? To make the image bigger like you can on a computer? Can you do that pretty easily with glass, or is that difficult? If you want to get like a close-up or something like that.
Right, so unfortunately right now there's no zoom function for glass, so really if you want to get a close-up you have to either get very close to the rash physically or take off the glass and just you know, zoom in manually.
Right, right. The old-fashioned way.
Exactly.
Right.
Okay. Okay. Any other algorithms that you can think of that it might be useful? I know that you mentioned thrombolytics are too extensive. I can't think of offhand any areas of the ER which is and certainly a triage nurse. I imagine that would be useful for her, right? She's in the waiting room and trying to pick out people that need to go right back to the ER and ones that can wait. You think it'd be useful for the triage nurses too?
You know, I think it might be useful for, say, the nurse floor manager or somebody who's dealing with admissions more than the triage nurse. I mean, I think we have a good system in emergency medicine for triaging sick people who need to come back immediately, but a frequent problem that I think a lot of urban academic centers have is that, you know, you frequently get into a bed crunch where you have a long ED boarding time, and if the charge nurse, you know, had glass and could instantly see or get notified when beds are open or beds are available, you know, that might be an interesting heads-up thing. But once again, you know, the question is whether the nurse would, you know, these people would prefer wearing glass and having a small heads-up display, or, you know, would these things be better on a tablet?
Well, you know, just from not even having worn glass and being away from the ER for a few years, and I think about, wow, that would be useful when you want to order labs quickly without, you know, when I was working in the ER, you'd have to, oh, this patient needs a CBC, a piece of certain lab tests, and I see it as something you could just order, test by the bedside without even leaving the bedside. Do you foresee a use like that for ER docs? Ordering X-rays, just going boom, 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 and then moving on to the next bed without having to retreat to the nurse's station and write it down, write the orders, etc. You think that would speed up the process of patient treatment in the ER?
Yeah, I think that's certainly an exciting possibility. I think it's still at least you know, a few years down the line, as it requires you know, integration with EMR, and I think it's a lot more sophisticated technologically. But going back to your idea of a triage nurse earlier, one other potential avenue that we're actively looking into is the field of community paramedicine, and this is a rapidly growing area within emergency medicine where paramedics essentially have expanded roles to either you know, follow up with patients that are at high risk for readmissions, or field calls where they're able to triage lower acuity patients to settings other than the emergency department. So, you know, in those cases, I think it would be useful for the paramedic to be wearing glass and to have a physician on backup if necessary to make their decisions.
You know, with the maturation of wearables too, that would, if you were able to check so many variables with wearables, as well as the visual inspection of the paramedic, that would help complete the picture to get a total look at the patient. But I know with teletrauma, in certain areas, there's a hospital in Maine, in Bangor Trauma Center up in Portland. They cover a huge area, and there are some patients that need to be helicoptered. I know we mentioned that you guys don't do much of that, but there are certain areas like in Portland where they have to determine, well, should we send a helicopter or not? glass might help in that decision making by having the physician kind of there to get a visual of the patient. You guys have any comments on that?
Yeah, I think that's going to be a very exciting as well. You know, there are some telemedicine programs already that do kind of a bird's eye view of the trauma room at a remote trauma center. But you know, having a trauma surgeon or kind of an experienced ER doc on the other end, and having the consulting person wear glass and seeing the trauma from the you know, the transferring doctor's perspective, I think would be huge. You know, another potential advantage of doing that is, you know, if you see a sick trauma patient that needs an intervention, needs a chest tube, for example, you can guide the patient, you can guide that doctor through it. You can, you know, kind of see exactly what they're doing and give them some pointers and at least watch them and help them out from that perspective.
Yeah, so specifically up in Maine, they had what, you guys familiar with the iPod? Not the iPad, it's an iPod. It's a small visual device. They were using that actually in remote trauma. They were transmitting the image back to the trauma center with the iPod, and they were having pretty good success. It's a very inexpensive unit. It's like $250.
Sure.
And I'm not sure if they're going to continue using glass. But the problem with the iPod was that the EMT had to physically hold it in his hand. And as one of you guys mentioned before, sometimes you need the hands. An EMT especially needs his hands free to start IVs, extricate, or to do whatever he had to do. And having the glass is a much better solution with that, because he could use his hand plus transmit the image at the same time. Okay, gentlemen, I appreciate you taking time out from your schedule to talk to me tonight. I hope you can see the rest of our hangouts in other areas of medicine, and certainly you guys, please let me know if you want to talk about some other area of medicine in the future that you may have use for glass, or anything you want to talk about in the hangout is fine. Yes. So I'm going to stop the transmission and we'll chat for a second. Okay, thank you, gentlemen.
All right, thanks.